welcome to the Dr. Tim Jennings Show, where we seek real answers to life's real problems. I'm your host, Dr. Tim Jennings, here with my co-host, Lori Atkins.
Hi, welcome to Dr. Tim Jennings Show. We're glad you joined us today. Today's topic we're going to be talking about is ADHD and that diagnosis. Dr. Jennings, what is ADHD?
Well, the letters ADHD stand for Attention Deficit Hyperactivity Disorder. Okay. And ADHD is a disorder of the prefrontal cortex, primarily the brain, and some of the motor pathways if you've got the hyperactive form. The inattentive form, the prefrontal cortex and the part of your brain behind your forehead, that's where you reason, think, organize, plan, self-restrain, problem solve, prioritize, and these types of things. And then the motor pathways that initiate motor movement and so forth. So people with ADHD have dysfunction of these pathways, primarily related, it could be several neurotransmitters, but dopamine is often thought to be involved in both of these pathways.
Okay, and so how does that manifest itself? What can you see in some people that are suffering from ADHD?
So there are three forms that are classified in the DSM. There's the inattentive form, the hyperactive form, and the combined form, where you have both. So the hyperactive is pretty easy. That's somebody who's fidgety all the time, can't sit still, basically a person who has no governor to govern the energy output of one's being. Whether that's physical motor movement, fidgeting all the time, or verbal, they just are spouting off all the time. They can't wait their turn. They're just jumping all over the place, okay? So that's the hyperactive form. The inattentive form, and by the way, the hyperactive form in kids is almost always diagnosed in kids, almost always, because it's hard to miss. These kids stand outside the norm. All young children have a certain level of energy, certain level of impulsivity. The prefrontal cortexes aren't developed, so they all have a certain level of that. The hyperactive kids, though, stand outside the norm. You put them in a room of 30 kids, and one kid is completely
at another level,
several gears above all the other kids. They get identified. Okay. The inattentive form, though, often doesn't get identified in childhood. And the inattentive symptoms, without the hyperactivity piece, are distractibility, procrastination, disorganization, difficulty paying attention, mind wandering, daydreaming. So they miss bits of information here and there. They make mistakes. They misread questions. That when they read, they have to reread the same material multiple times because their mind wanders while they're reading. They miss parts of conversation because while somebody's talking to them, their mind wandered over. Oh, what did you say? And this is the inattentive form. And oftentimes, now kids with average IQs or lower average IQs will often get diagnosed in childhood because they fall behind and their grades fall, and they look for reasons why their grades are falling. And so if you have average IQ, low average IQ, often they will, in inattentive form, be diagnosed. But the bright kids, the kids above average IQ, they often don't get diagnosed in childhood because they don't have to pay attention very long to assimilate enough information to at least be average.
And they're able to mask it.
And so they often will be identified scholastically often as an average or maybe a little above average, but not necessarily a stellar student. But average is okay. You're not failing, so they kind of slide on through. Yet they still have this problem. They're not actually operating at their actual true potential. So those are the symptoms.
Okay. So is there a difference between the diagnosis of ADD and ADHD?
So just in historic nomenclature, over the course of time, disorders get updated and renamed. Historically, the old name was ADD. And now the new name is ADHD, either inattentive type, hyperactive type, or combined type. Okay.
And what are some of the causes? What can cause ADHD?
So there's been at least 50 genes identified thus far that are associated with attention deficit hyperactivity disorder. And genetics contribute to about 75% of the ADHD problem. So there's a high genetic preload or predisposition. 75% of the cases have a genetic relationship to that. So, and this is dysfunction of prefrontal cortex. However, anything that contributes to dysfunction of prefrontal cortex can contribute to ADHD. Now, genuine ADHD has to manifest in childhood. Okay. So it could be gene constellations. You're born in a certain way, and these genes could be the genes that direct the development of the neurotransmitter energy molecules that make the neurotransmitters, or that transport them, or the enzymes that break them down. And we've identified 50 genes in this whole system, and break down any of those genes in that pathway can result in signaling problems that contribute to ADHD.
Okay.
But if mother smokes while pregnant, or she lives in a city with high air pollution, the polyaromatic hydrocarbons, that's the pollution from fossil fuels, has been documented, if it's a high enough concentration, the mother's breathing it while pregnant, to alter brain development of the developing fetus, such that they have prefrontal cortex, white matter problems, and they have higher rates of ADHD. But that's, again, a brain developmental problem now, not necessarily from genes, but because of developmental stressor. Lead poisoning in childhood could contribute. Preemie babies. Preemie babies have higher rates of ADHD, and I think people can kind of get their mind around that. Well, they were born before their brain finished developing to the normal portion of development, and so they can have a higher rate of ADHD for that. One that people may not know that can contribute is theatrical TV. Theatrical TV, not educational TV.
Right.
Okay. Now, studies show that any TV at all, whether it's educational or theatrical, before the age of 2, delays language development in all kids. So American Academy of Pediatrics and Child and Adolescent Psychiatry recommend no TV watching for kids under 2. After the age of 2, though, it splits. Theatrical entertainment, what it does functionally to the brain is it activates emotion circuits while suspending activity in the prefrontal cortex circuits.
Okay.
Now, one of the design laws upon which reality is built to operate, and design laws of health, laws of physics, laws of gravity, is the law of exertion. If you don't exercise something, if you don't use it, you lose it. Okay?
Right.
If you want it to get stronger, you've got to exercise it. So your brain is an organ that needs exercise. If you are not exercising your prefrontal cortex circuits of reason, planning, organization, self-restraint, problem-solving, thinking, and all the different things you do when you're a kid, okay, that normal stuff, and instead you're watching theatrical programming, and theatrical programming activates mood circuits while suspending thinking, suspending reasoning, and you watch that has actually been shown in multiple studies to overdevelop motion circuits and underdeveloped prefrontal cortex, and contributes to increased attention problems, so ADHD, impulse control issues.
Gotcha.
Okay, more aggression, more acting out, more violence. Toxic substances, inhalants, glue, okay, and other toxic substances can damage the brain and contribute to these types of problems as well.
Do you think that this is a new phenomenon, or that it's always been around and maybe it just wasn't diagnosed, or we didn't have a name for it?
So that's a great question, and I think the genetic piece clearly has been around for a long time. And so that genetic piece, and I think it's always been here. We look in society. I will tell you, I have a theory. Maybe I shouldn't say this theory because people think I'm off the reservation somewhere. but understanding how ADHD people work. ADHD people are risk takers.
Okay.
They don't think through the cause and effect. Something looks fun, let's do it. They jump at it. They go for it. Okay. And there's actually a reason for that also, because those exciting things stimulate dopamine and actually help them function better. So they're often doing risk to try to artificially kick up the dopamine they don't have.
Yeah.
So I think this has been around a long time. And my personal theory is when they look at, a higher ADHD in America being diagnosed than in Europe being diagnosed, and people say, well, maybe we just have different diagnostic criteria. We're just being liberal in our diagnosis. I actually think it has to do with immigration. And when people left the old country and got on a sailing ship to go into an unknown part of the world for 3 months on a ship, what kind of people are going to leave security and go? These are people who are risk takers. Okay?
Yeah.
So I think there may be a historic piece that could be traced back that certain populations, certain individuals chose to come and take the risk because they were more likely to be genetics for ADHD and not think through the risks and stuff involved. So I think it's been around a long time. However, maybe the relevant question is it getting more common? Is it actually going up? Well, theatrical entertainment, TV, has only been around since 1945.
Right.
So we've documented that actually has a neurobiological change on developing brain. So since 1945, you could say, yes, the influence of TV isn't. How about the inhalants and some of these chemicals in society? They've gone up.
Yeah.
So there's many, many things happening in our society now that are contributing polyaromatic hydrocarbons, fossil fuels. That didn't happen until, I guess, around the turn of the last century when the
Industrial Revolution.
Industrial Revolution. And so that led to an increased rate of these things too. So yes, I think environmental environmentally, we're doing a lot of things to affect brain development that is increasing the rates of ADHD from historic past. But I think it's always been there.
Right. And then if it is so genetically related, the fact that we're increasing that just guarantees it's going to continue to increase in the future.
Yeah, that's
we're passing that down.
Yes, and so there's the 50 genes that I mentioned, and then there are epigenetic changes.
Right.
And so these environmental things would be affecting the developing brain and potentially altering epigenetic or gene expression. And so even if you don't have those bad genes, you might alter how your genes are expressed so that your kid may have more vulnerability even though you don't have the bad genes.
Right. Now, I've heard some people suggest and seen some news that they think maybe vaccines are contributing to ADHD. Is there any evidence to support that?
Actually, there's strong, robust, repetitive, repeated evidence that they do not cause. So that's been looked at very aggressively, very strongly, and there's no evidence at all of a linkage between vaccines and ADHD.
Okay. So if a child is energetic, likes to move around, likes to play instead of study, can we just assume that they have ADHD?
No, that would not be the thing to assume. Normal children can be active, okay?
Right.
It's the ability to calm oneself, to actually, when appropriate, self-restrain. So activity in normal kids, we shouldn't just look at active kids and say you've got ADHD. We should look at other factors. There's a lot of other variables that can cause kids to be active besides ADHD. Kids that are in homes in which maybe there's a lot of conflict and stress, or they've had some major trauma. There's been a death in the family. The mom or dad's been killed. I mean, there's a lot of reasons kids can start acting out behaviorally that have nothing to do with ADHD, and I think it would be remiss to just reflexively say, oh, there's a kid who's really more energetic and acting out and behaviorally and impulsive. Well, it must be ADHD. You don't jump there.
Right, right. So what about, so you mentioned trauma or conflict in the family. What about a physical injury, like a traumatic brain injury? Can that contribute to?
So in childhood, yes, because it's developmental, technically it may not be, but it would still be diagnosed as ADHD because the developing brain that never develops the ability, and so this child would grow up with these symptoms. It may have been caused from a head injury in childhood, and yes, that could cause prefrontal cortex impairment that has these same symptoms, and in a child would be diagnosed as ADHD.
Okay.
In an adult who has a brain trauma, and then prior to the brain trauma, they didn't have these symptoms, but after the brain trauma, they'd have the same symptoms of inattention, distractibility, impulsivity, and these types of things. That is not ADHD. That would be a traumatic brain injury with a subsequent cognitive or other disorder due to the brain injury.
Okay, okay. What about sugar? Sugar in the diet, can that cause ADHD or mimic the symptoms?
So this is what many people think, and the data does not support that sugar in the diet is related to ADHD at all. All studies done thus far document there's no link between sugar and ADHD. One study actually took parents who believed their kids were ADHD from sugar and put them on NutraSweet and told the mothers they were on sugar. The other kids were actually on sugar. The mothers who thought their kids were on sugar were actually on NutraSweet, rated them as being much more ADHD than the kids who were actually on the sugar. And so the data does not support that there's a relationship between sugar and ADHD.
Okay. We are going to come right back and talk more about ADHD in just a moment. Welcome back to the Dr. Tim Jennings Show. Today we're talking about ADHD, or Attention Deficit Hyperactivity Disorder, and what we can do surrounding that diagnosis. Dr. Jennings, we talked about sugar a little bit. What about some other additives that we're putting in food? Is there any correlation between some food additives and symptoms of ADHD?
No, this is a very reasonable question. And some research out of Great Britain has documented that certain food colorings have been associated with the ADHD syndrome or symptoms. And if you remove those colorings out of the food from these individuals, that their attention attention symptoms went away.
Wow.
And so what seems to be happening in those individuals, now that's not true for everybody, but in a subpopulation, they were having a evidently neurotransmittal signal problem being interfered with by the food coloring and food additives.
So just like in general, less processed food probably always better.
Yes, no doubt about it. So the healthier, more holistic foods that you give your children, the better their brains are going to function. There's no question about that.
Right.
And we don't know all the different chemicals and substances have not been tested. So it would be very reasonable to move toward a whole food diet.
Right. So what do you say? I've heard some parents that may have had their children diagnosed with ADHD and they've tried some things, some diet changes, some other things, and have said that they've seen the symptoms subside, or they've seen them cured, stopped sodas.
Okay, so I would have to first say, did you see the symptoms improve, but they still had symptoms? And so after all the interventions, their symptoms are 50% better, but they still have attention symptoms.
Right.
Okay. All right. Well, then clearly you were doing something in the environment that was worsening the disorder, but they still have the disorder.
Yeah.
Versus, well, they don't have the disorder once we take the sodas away or something like that. If that's the case, well, my kid was cured when we took the soda. Well, they never had ADHD.
Right.
Then. That's not ADHD.
Okay.
ADHD is a brain disorder, a brain dysfunction, neural signaling problem that has this constellation of symptoms with it.
Yeah.
Now, can you get that from perhaps in certain brains by giving them certain chemicals that can cause them to have that syndrome of symptoms? Yeah, and you take those chemicals away, and then the symptoms go away, and you go, ADHD is gone, I've cured ADHD, and you go out and tell all the parents in the neighborhood, if you just take your kids off soda, they won't have ADHD. Well, that may not work for those kids because they may not be having the same reason they got the same prefrontal cortex syndrome or symptoms.
Right.
Okay?
Right. Okay. So what are the risks if your child has ADHD and they're not getting treatment?
What are the risks for the child not to get treatment
Yes.
for ADHD? So let's assume that the child has ADHD. It's not something that mimics ADHD. It's not a mimicker. It is really ADHD.
Right.
And the child doesn't get treatment. Well, maybe we should help the parents kind of understand what it's the best we can pretend here, what it's like inside the world of an ADHD kid.
Okay.
And why life's hard for them. So ADHD kids in school, they're in a classroom. And the teacher is saying, let's lecturing on the capitals of Europe. And the capital of Italy is, and this is in the kinds of kids' mind listening, the capital of Italy is, look at that bird out there. I don't know if we have birds like that. There might be a nest back home like that. And the capital of France is, look at the pen that child has over there. I wonder if my mother would get me a pen like that. I hope my mom would get me a pen like that. I wonder if they would let me borrow it and try it. And the capital of, and this is how it goes all day long. And then what happens is they're for a moment of what's saying, they're missing what's saying, and the teacher says, then calls on the child and says, now what was the capital of Italy? And the child looks stunned, doesn't know, didn't hear.
Yeah.
The other kids laugh.
Yeah.
Okay. The other kids laugh. So this untreated ADHD not only leads to worsening performance, the child now is developing a sense of who they are.
Right.
As compared to the other kids. I'm not as smart as the other kids.
Yeah. I'm
not as bright as the other kids. I'm dumb. I can't succeed. Okay. And so they develop an internal mindset of inadequacy.
Sure.
They often won't try. They won't push themselves. They won't excel. They may drop out. Okay.
Right.
So they all, and the data shows this to be true. And I have a lot of adults that come to see me that are so heart-stricken as they realize I put them on the proper treatment, and they go, "Wow, I wish somebody had done this for me years ago." Further, data shows that untreated ADHD kids have higher rates of substance use problems. Many people say, well, but the treatment is controlled substances like the Ritalins and the Adderalls and things like this. This is scheduled. This is controlled medicine. Aren't we going to cause drug problems? We give kids these medicines. No, the data is the exact opposite. You actually significantly reduce the likelihood children will use drugs. Think this through. Your prefrontal cortex is where you reason, where you problem solve, where you anticipate problems, where you can see cause and effect before you take an action. Further, prefrontal cortex is where you have good judgment. Further, prefrontal cortex is where you self-restrain. Okay? This is the part that's impaired in kids. Now, the deeper limbic circuitry, that's where you get your impulses and your moods and so forth. So if you're getting on the interstate and somebody cuts you off in traffic and you get that aggressive urge to say an ugly word, okay, that's your limbic system. But if you go, hold on, wait a minute, I'm a Christian or I'm a mature person, I'll behave that way, and you restrain yourself, that's prefrontal cortex. This is impaired in ADHD kids. So they'll blurt out things, they'll have more relationship problems. But they'll have, when they hit adolescence and the hormones hit, they'll have lots of moods they can't process well. And so they often look to substances. they're more likely to start smoking, more likely to use alcohol, more likely to use drugs, more likely to act out sexually than if they were being treated. And this is well documented. Not only that, the distortion in their sense of self. They lose confidence in themselves. They don't trust their own judgment. They look to others to tell them what to do. So there's a whole long list of negative consequences to kids with ADHD if we don't treat them.
Gotcha. And is there evidence that shows that the treatment actually works?
Absolutely. Multiple. Thousands of robust studies show that the core symptoms of ADHD, and I'm talking Cadillac study, expensive. Because the kids are concerned, they poured big time money into evaluating legitimacy because of parents' concerns that their kids are being drugged and certain segments of society that make the allegations that these kids are being put on drugs for no reason, and the fears and the heightened. Lots of money has been poured in to look at this very aggressively. And the data shows that the core symptoms of ADHD, the inattention, the distractibility, the ability to prioritize, plan, to carry out tasks, to stay on task, the core symptoms have no improvement without medication.
Wow.
With social interventions, with psychotherapeutic interventions, doesn't improve them. The core symptoms improve with medication. Because it's neurobiologically driven. Okay? You have to turn on the prefrontal cortex, particularly when we're talking about that group that have that genetic family history. Okay? Is it possible if their attention symptoms are related not from genetics, but developmentally because they watched a lot of TV and they never developed the prefrontal cortex? That group has the potential, if they get the TV out and really begin exercising their prefrontal cortex, that over the course of time, their attention symptoms may fade away and they may not even meet criteria anymore because they don't have the genetic predisposition for it. It's just the developmental lack of the resources to pay attention.
Right. I've heard you describe in one of your lectures, you described leaving a child with ADHD untreated is like expecting a blind person to be able to drive a car and not get hurt.
Yeah, I mean, there's a lot of truth in something that I think that's right. What do you expect from an ADHD kid? You expect him to self-restrain, but you won't let him turn on. So I give the analogy of eyeglasses, okay? And I tell kids, adults that come see me, imagine that you had bad vision. But you're a child, so you've never seen the world any differently.
Right.
So you don't know it's bad vision. And you sit in the back of the room, and the teacher writes something on the board and asks you to read it, and you misread it, and everybody laughs at you, and you conclude, well, I must be stupid.
Right.
Okay? That's ADHD kids without meds, and your IQ's fine. You just need a glass where you can focus. Now, glasses help the eyes focus. The meds for ADHD help the mind focus.
Okay.
That's all it does.
Yeah.
Helps the mind focus.
Okay. So if one of our viewers has a child that has ADHD, what should they do? What's your recommendation? So
first thing, if you're suspicious or concerned, get a good professional, qualified evaluation. And, a really good, somebody who's got real good experience in doing a good workup so that you can rule out potential other contributing mimickers of ADHD. And what are some mimickers of ADHD? Mimickers of ADHD could be a severe sleep disorder. If you're sleep deprived, sleep deprivation looks like ADHD. Your prefrontal cortex is impaired from sleep deprivation, okay? And so if you have a maybe very large tonsils and a child's got sleep apnea and they're in and out of sleep, stage 1 sleep, they might have attention symptoms that they wouldn't otherwise have. They maybe have a thyroid problem. Maybe they have significant anemia. Maybe they have vision impairments or hearing impairments rather than ADHD. So you want a good physical exam to make sure the child's healthy in every other way. And then you want them to be put through some standardized testing of some sort that can actually test in a standardized way their attention and distractibility and so forth. So get a good workup and assessment. That's the first place to start.
Okay.
And then once ADHD is confirmed, then you want to talk with a healthcare provider about the various treatment options. There's a lot of different treatment options out there. Medications are going to be the core for the treatment of ADHD. The social and therapeutic interventions can improve socialization, meaning how I can get along with other people, but my ability to stay on task, my ability to organize, my ability to plan, my ability to self-motivate, my ability to get a project done when I don't feel like doing it. And what happens for kids with ADHD, because they procrastinate, because they can't motivate, it's nothing they're interested in, they will wait till the deadline approaches. And as the deadline approaches, the urgency and the fear of the deadline activates their stress circuitry. The stress circuitry of your brain causes the adrenaline to kick up. The adrenaline hits the norepinephrine and dopamine, and they actually are medicating themselves through stress.
Gotcha.
Okay? And this is why ADHD kids are often doing things that cause them more stress because they're trying to treat themselves so they can function better.
But subconsciously.
They're not even aware they're doing it.
Yes.
This is why they will scramble to beat the deadline, but they don't get to it until the urgency gets to a certain level. And when the urgency gets to a certain level, that's when they kick in and do the action. And the parents and people that don't understand what's going on is going, why won't you do it? Why do you make this hard yourself? You see this pattern of behavior, it's an indication it's probably ADHD.
Gotcha. And I would think the therapy part could help if they have already started those negative thought patterns and negative self-image. Can help to reverse that.
Yes. Now, some of the studies show, because remember the law of exertion, focused meditation. Focused meditation where you're focusing on a single point, like a dot on a wall, and you're gently pushing away all of the thoughts, and maybe 15 minutes a day, focusing on a dot on a wall, and pushing gently away other thoughts. That requires you to exercise the circuits of attention and focus. And so even if you have ADHD and you exercise the circuits, the brain will get stronger. If you use it, it gets stronger. So if you practice that, and the data shows kids who do focused meditation, adults who do focused meditation, have improvement in their attention symptoms. They get better.
When I would think that would be especially difficult for folks who are suffering from ADHD.
Yeah, you're correct, but if they do it and practice it, they can actually have benefit from it. Other things parents can do is restrict theatrical TV. Really stop letting them watch so much theatrical programming. Educational programming like History Channel and stuff, no negative consequence, but the theatrical programming. And obviously avoid toxic substances, get good healthy nutrition. Omega-3 fatty acids with fish oil, good for kids' brains. Kids low in those can have more mood and attention and focus problems and more impulse control problems. And ensure you get normal sleep. And physical exercise is very important.
Okay.
I don't know if we have time to talk about physical exercise. I don't think we do today. But kids need physical exercise. It helps the circuits of the brain that organize and initiate thoughts. As we get regular physical exercise and learn to organize our physical body, those same circuits that bring coordination and organization to our body movements are used in organizing and focusing and organizing our thoughts. So kids need lots of playtime and lots of activities where they can use their bodies in healthy ways.
Excellent. These are some excellent tips. So I want to encourage you, if you believe your child has ADHD or has been diagnosed with ADHD, see your physician, get a good workup, and visit our website, timjenningsmd.com, for more tips on this and more other important subjects. Join us next time on the Dr. Tim Jennings Show.